feel reassured if we're like, we didn't find anything in your body. So how do we design the proper study? Who are the right people to be designing that study? And how we proceed from there. So my role, I'm not a researcher, as a disclaimer. I am a hospital medicine doctor. I am a musician. But I am in love with my people I serve in San Francisco and in this greater Bay Area. I love the people I serve. And I feel very strongly that when there is this kind of injustice, that we all need to rise together to the occasion to answer a community's request for help. And so that goes above and beyond politics. That goes above and beyond what the mayor's office wants, or what the Surgeon General wants, or what whoever wants. That just goes directly to the people who are suffering these health outcomes. So this is the team we're assembling right now. So you saw Dan Hirsch, he's down at the bottom. He's a professor of nuclear policy. He's done a lot of studying around how we look at the health effects of radiation. He detailed for me the 36 radionuclides we need to look for in people's bodies. He detailed for me the different methodologies that we need to use and the pitfalls, because he's done studies like this before. Not exactly this one kind, but studies that would be helpful surrogates to understand what our pitfalls are. We have Dr. Robert Gould, who's on faculty at UCSF in pathology, also understands the toxic effects of radiation on the body. He's also the president of the San Francisco chapter for Physicians for Social Responsibility, and a very just strong methodologist on like making sure we get it right, because the worst thing would be is we show up and we do a study and it doesn't answer the questions that we're really looking for. And then finally we have Dr. Tracy Woodruff, who is the director of the program on reproductive health and the environment at UCSF, and she is just an awesome person to look for environmental health issues. And she just recently completed a study looking at fetal cord blood of women who are giving birth at San Francisco General compared to women giving birth at Mission Bay, and looking at the differences of body burden of environmental pollutants.